Hi, and welcome to episode 294 of the Untethered podcast. Today we have Brianne Lee joining us. Brianne is a mother on a mission. She believes that children deserve far better than what today's current childhood landscape has to offer. She's an advocate for homeschooling, homegrown food and gardening, homemade childhoods, and a natural, unplugged lifestyle. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered podcast. I am your host, Hallie Bulkin. I'm a certified myofunctional therapist, feeding specialist, podcaster, business owner, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, airway, tethered oral tissue, and pediatric feeding therapy space. If you're new here, I challenge you to keep an open mind and join my mission to spread this message far and wide. If you've been around since June 2019, thanks for being a loyal listener. As we jump into today's episode, remember to listen with correct oral rest posture. Tongue up, lips closed, teeth apart, breathe through your nose. Let's get started. Brianne, welcome to the podcast.
Hello, Hallie.
I am excited to chat today. I know we've been chatting for a little while before hitting record, and I recently found you online through Greg, a mutual social media friend. And I know the rest is history, but I want to dive in, and I'm going to let you share your story, and we'll talk all about all these fun connections that, I think we have and whatnot. But you've been through a lot. The story that really caught my eye was when Greg was screenshotting and sharing people's experiences with having their wisdom teeth pulled and finding out later in life that a lot of chronic illness that you've experienced could very well be tied back to some infections, related to that procedure, right? Stemming back to your childhood. And so I'm going to sit back and kind of let you tell your story, but it made me start thinking oh my gosh, I had my wisdom teeth pulled and they were two were supposedly impacted, two were supposedly fine, but all four were pulled. I've been recently diagnosed with mast cell activation syndrome this summer by functional medicine. I've been now working on healing that with another practitioner. And it just kind of made me stop in my tracks when I read this. And I was like, Greg, can I contact this person? I need to know her story. And here we are, a week later recording. So again, I'm going to turn it over to you, but you start wherever you want to. I just think this is a very fascinating topic that we have not discussed on the podcast, at least not from a wisdom teeth perspective yet. So Brianne, take it away.
Okay, Hallie. So first we have to travel back in time. So I had my wisdom teeth removed almost 30 years ago. So I'm 43, and they were removed when I was 14. So from a clinical perspective, for that procedure, I was actually very young. In the US, most wisdom teeth are not removed until late adolescence, early adulthood. Think the college years. Most people are 19, 20, 21. The reason why they were removed at such a young age is because they were all four impacted, right? So I think your listeners probably know that means that they were growing in sideways and that it was going to cause a pretty significant clinical impact on my jaw development and maybe cause big problems. So at the time, my parents were advised, your daughter needs surgery. All four need to come out. Now, 30 years later, I have obviously compassion for the decision that my parents made. I'm not upset or anything. But I have a completely different perspective on oral health and how that ties into holistic health for the whole body, because so much of, I think, how almost all of us were raised is that everything is siloed. So sinuses, oral, dental, lungs, respiratory, digestive, everything was siloed, and there was not 30 years ago as much of an awareness of holistic health. And so what I know now is so much different than what my parents knew. And I have been on my own personal healing adventure It's for me, it's more than a journey. It's been like a wild adventure, because pretty shortly after my wisdom teeth were taken out at 14, it was really about 4 years later. I was really only like 18 years old. Pretty shortly after that, I was in the medical system and I'd already been diagnosed with 2 different autoimmune diseases.
Wow.
So this connection that I'm now making 30 years later, believe it or not, your audience is listening to me parse through this in real time. So I have been doing all the things. I have been doing all the things for almost 30 years, just in terms of like that slow peeling of the onion, looking at this, looking at that, looking at this, looking at that, in terms of recalibrating myself back to homeostasis, like back to vibrant, radiant, good health. And I'm only just realizing that my wisdom tooth surgery may very well be playing a much larger role, if not, could be one of the drivers, the very drivers of my chronic illness, maybe like explosion that happened so shortly after in my adolescent years. I went to a biological dentist in September. So it's really only been about 6 weeks since this information even hit me. I was not expecting it. The biological dentist was actually the very last piece of the puzzle in terms of like my practitioner roll call. Do you know what I mean? Like I had already kind of scratched off all the other practitioners over the years, pediatricians, functional medicine practitioners, acupuncturists, like myofunctional oral therapy, like just so many things, right? And I think your listeners can probably relate and appreciate to that. But dentistry was the very last piece that I hadn't switched over to, holistically. And I knew that I needed to do it. And it was just one of those things where I had just been putting it off probably for like at least 2 or 3 years, because I have been on social media and I follow so many different functional medicine practitioners, holistic health, advocates, nutritionists, just people in the alternative health space. And I had been learning about the connections with oral health and health in general, and that there can be some red flags. There can be issues with wisdom teeth removal and with root canals specifically. Like those 2 things were the big red flag issues that kind of kept coming up, whether I'd hear it on a podcast or I saw, a reel of what like maybe a biological dentist had made it or something, but I knew that I needed to do it. And so 6 weeks ago I went, and sure enough, when the dentist took my full medical history, he afterwards said, Brianne, based on all of this criteria, based on the symptoms that you're dealing with, based on your medical history, I really think it's important that we do a cone beam scan. Do you know what that is? And I said, I do know what that is. Yes, I'm happy to do it. Let's do it. And he said, I do have a suspicion that some of the problems that you're having, the high levels of, chronic inflammation, some of your autoimmune conditions, they may be related to a hidden or stealth infection. But let's see. And sure enough, that's exactly what he found.
Like I have chills. This is like, it's just crazy. I mean, it's crazy.
It was crazy to me. So I have to be totally honest. With your listeners and with you, I actually got extremely emotional at the office. A part of me knew that maybe this was a possibility, but at the same time, I didn't want like one more thing. I didn't want there to be one more thing that I had to deal with, because I've been through so much already. And he looked at the cone beam scan and he said, Brianne, I'd like you to come back into the office and we have to go over these results. He said that all 4 like cavitations were some of the most severe he's ever seen. Wow. And I was like, I'm not surprised. I'm not surprised based on how I feel, and a lot of just like the ups and downs that I've had over the years with chronic illness. And he explained to me, he went in depth about what the cavitations are, how they form, what the risk is for removing wisdom teeth, and or root canals when you remove the ligament, I think it is the ligament and the nerves. And when you leave that empty cavity, unfortunately, you do open the door for infections to set in if the innate immune system or the body, for whatever reason, doesn't have the ability to regrow the bone, and keep it, I guess, sterile, right? And it's difficult because at this point I'm left with another big choice. Do I have, jaw surgery on top and bottom, because I'll need both? And just to let your listeners know, it's definitely not something to be taken lightly, because it's, I think, a 4 to 5 hour surgery. So it's a long surgery. He said it's like about an hour to an hour and a half on each site. So, I mean, it could be like 4 to 6 hours. And you have the choice of being put under general anesthesia, which carries its own risks, of course. And again, I think your listeners are going to be really sensitive to that. I have a lot of, I wouldn't say I have a lot of anxiety about general anesthesia, but being in the holistic health space and listening to alternative practitioners and understanding what these drugs do in the body, and just the risks associated with it, for someone that lives with an impaired immune system, chronic illness, autoimmune issues, that's not something that I take lightly, right?
Right.
So there's also, unfortunately, the addition of required antibiotics. So you've kind of got this double whammy on the system, where in order to fix the problem, you do have to sort of like take a gamble. You really do have to take a gamble. And so just to be totally transparent, I am working through it as we speak, right? I've been having conversations with my husband. I've been having a lot of conversations with God, to be honest. This is something that I think really has me leaning deep into my faith and looking for discernment. I'm really looking for that inner discernment to know what is the right healing path for me to take, and just ultimately having trust and faith in God that I will be led to make the right health decision. But I think the biggest reflection that I have now as a grown woman and as a mother is to make the connection and go back in time, and to look at the way in which palate development and childhood development carries such an enormous, enormous impact throughout our whole entire life. And when we miss childhood, palatal, jaw, skull, craniofacial development, when we get it wrong, and most of us are getting it wrong, and you know this, and I think your whole audience knows this, when we get it wrong, I really truly feel that almost nothing else can go right. And that's what I really truly have come to believe. I see that in my own body, and I'm now living through it a generation later as a mother, raising 3 children. My children are currently 10, 13, and 15. So I'm right in the thick of the orthodontic world. Now, for most people, it's kind of like, oh, well, you should be done by then. And unfortunately for me, I got tied up with practitioners who missed, just like what happened to me 30 years ago. A lot of like the red flags were missed. and a lot of what we now call airway development, and airway focused dentistry and orthodontics, that was missed in me 30 years ago. And unfortunately, I was with practitioners for the last several years raising my children who also missed all of the red flags. And so now my children are kind of on that later stage of development, and I'm having to play catch up. But I am hell bent on salvaging and repairing and getting my 3 children everything that I possibly can, so that they are spared the surgical trauma and the sort of immune trauma of what happened to me 30 years ago. Because the truth is, if we look back in time, if my palate and my jaw had simply been addressed or caught when I was a child, and I just got some simple interventions, my jaw would have been full enough. I would have had the ability to have my wisdom teeth come in. They wouldn't have been impacted. I wouldn't have had to go through the surgery, and I wouldn't have had 30 years of a hidden stealth infection in the bones in my jaw.
Yeah.
So when you think about it that way, when you can zoom out and you can see the consequences of this huge issue, I think it really, I think it becomes real. And I was saying to you, I can joke about it. I still have a sense of humor despite everything I've been through. Like, I really think that I'm a cautionary tale. I really do. And I want your listeners to know that if they find themselves in a similar position to me, and they're grown women and they're mothers, and maybe they have some health challenges, I would say just don't overlook the piece of your oral and dental history, because it does really have an impact in our overall health. And so I think the bottom line is, no, it's not a silo. Like, it's not separate. And this actually brings me into such an interesting topic that I wasn't sure we were going to talk about, but now it just popped into my head. Yes, everything is interconnected. No, nothing is a silo. And when we talk about going back in time and we talk about like the surgical trauma, we also have to talk about the fascia. We have to talk about the impact on the fascia, and that like the fascia remembers. And so I don't know, Hallie, have you interviewed Dr. Barry Gillespie yet? Has he been on the show?
I have not had him, but I've had others who teach and who have taken his courses on the podcast. Yes. So
Okay.
CFT, CST, CFST, all of the above. Yep.
Yeah. So I think that is also such an important factor for us to remember, because anytime there's surgery, anytime there's a trauma, no matter where it is in the body, there's going to be a fascial impact. And what I've learned, which is so fascinating to me, is that our fascia, right from the base of our skull down to the tip of our toes, is all connected. And when I had an appointment with Dr. Gillespie last year, and I called him on the phone. And so he's taught me so much. And by the way, he is such a character. I absolutely love him. And if you could ever get him on, you should. He is like a riot. He's got such a great personality. But I called him to make an appointment, and we wound up talking on the phone for like 30 minutes. We were just chatting, he and I. And maybe that's just because of my personality. I love to talk. But he was literally, he just started teaching me. He just started teaching me things on our phone call. And he was asking me questions about my 3 children. And I had told him, as of last year, I said, Dr. Barry, my 3 kids are all they all have metal in their mouth right now. They're all currently in orthodontic care. And he said, I can't, in good conscience, I can't take your money. I can't see them. He's like, I really can't work with children who have metal in their mouth. And he kind of explained to me the reasons why, his kind of philosophy, his background because he spent I'm not sure. He started his career as a periodontist. He was a periodontist first. That's where his background was. So like very conventional. And I think similar to so many of us. And I think the reason why so many mothers like gravitate towards him in the holistic health community is because he mirrors that same trajectory so many of us had. He started out so conventional,
Yeah.
and he saw the fallacies and the letdowns and the problems, and he had his own revolution. He had his own transformation, and he has seen everything from both sides of the spectrum. And so I feel like he really understands, and has such a unique and fascinating perspective on like how the body works, because he has that surgical medical training, but he also is, I mean, he's a genius, like, and he's so inventive, and he created this therapy. And so I think it's a wonderful marriage. And I think that so many of us, and I can speak for myself, but you and I, before the show hit record, we shared some, a little bit of our history as moms. But I think a lot of us started out that way. I think a lot of us were more conventional, and it was unfortunately for us only through suffering or some kind of trauma or some kind of negative impact that we had to go through our own heroine's journey. We had to go through our own transformation, and we had to say, oh, huh, maybe there is another way. Maybe there is something else for me to look into. So Dr. Barry Gillespie, so back to him, he explained to me that, no, in good conscience, I can't take your 3 children on as clients, because what I think they need and what I want to give them is going to be very limited with the fact that they have their nervous system and their jaws locked, right? And that's what, at the time, I had 1 child in an expander and 2 children in braces. So that to me was really, really fascinating. And we'll jump forward a year. Where I am now is, well, we'll get to the practitioner saga, but I fired the orthodontist that I was currently using, and I took both of the children out of braces. I took the 3rd child out of the expander that she was currently in, and I prayed a lot, and by the grace of God, literally an angel was dropped into my lap, and I'll have to tell the story. So the founder, or one of the founders of Tooth Pillow, is now our practitioner, and I did not contact them. By the grace of God, this is only, truly, I think, divine intervention. They reached out to me. So it's a wild story, but that's essentially how it happened. So my 1 daughter currently has nothing in her mouth, and she's now able to be seen by Dr. Barry. So I am going to be traveling to Pennsylvania to get her a little bit of craniosacral fascial work to hopefully help with that fascial strain. And for your listeners, I don't know if you've talked to, like, if you've gone down, if you've had like midwives or like birthing professionals talk about the impact on traumatic deliveries, but really just any delivery, whether it's C-section or vaginal, and how that impacts the fascial strain. So I'm excited to get that done for at least 1 child. And then as soon as the rest of them are out of metal, we are definitely going to see Dr. Barry, because I think the biggest takeaway for me is that all of this starts at birth. And unless you can address it at birth, everything else that happens downstream, it's like you're fighting against the tide. So why not just start at birth? And I think for any of your listeners that are younger moms, or pregnant or not yet delivered, I would say definitely start to look into like the fascial network, craniosacral. I'm also a proponent of like osteopathic manipulations. Personally, for me, and I've had conversations with other girlfriends, like my holistic moms, personally, I'm not a big fan of chiropractic. I'm a fan of osteopathic manipulation, because it's just very, very, very gentle. And I think it follows a little bit more in line with the craniosacral and the craniosacral fascial network. So that would be, I think, a big takeaway is for younger moms. Like if I had to do it again, or I had a big sister, or I had a friend, or if there was social media 16 years ago when I was pregnant, I think that would be so huge, because regardless of what type of delivery you have, there is a strain on the baby. And it's like the way Dr. Barry was explaining it to me was that the pelvic, it's usually always starts in the pelvic area, right? And the pelvic strain pulls into the abdominal cavity, right? And then he talks about how that causes colic. And then it pulls up into like the esophagus. And he says that's a lot of times what causes like the spitting up and like the acid reflux. And then from the esophagus, it pulls into the head and neck and jaw. And that causes a lot of, sometimes tongue restrictions. So the fascia, I think the fascia is a huge piece. And it's so important for moms to hear this. And then lastly, what also blew my mind and what I will say is the tongue. And I don't know if moms know this, but embryologically, the tongue develops between 4 and 5 weeks. Yep. Does everyone understand that? So, I mean, that is truly, truly, truly right at the beginning. So embryologically, that is such a delicate time, and it's such a complex process, like tongue development. And I'm going to say something, I don't know if anyone else has said this the way that I'm about to say it, but it will definitely bring me into my next topic that I'm so, so passionate about, which is this. Tongue ties, and like medically they're called, how do you pronounce it? It's like ankylosing.
Yep, you got it.
Okay. So medically, so if you go to like PubMed, or you're like talking to, I don't know, like an ENT or something, maybe they'll say like, oh yes, ankylosing, right? So that's like the medical term for tongue tie. But if we look at the medical literature, there are about, and this is what I've researched myself, it looks like there are about 10 different embryological, essentially defects of the tongue that are listed like in the medical literature. Ankylosing or tongue ties like being one of the most common. But what I want moms to hear is that if we know that the tongue is embryologically developing between 4 and 5 weeks, and we now see a huge rise in tongue tie defects, we need to talk about why. We need to talk about why is that happening. And the truth is, it's a birth defect. And I don't know if anyone has like just said it out loud like that, but that's the truth. And so
we call it like a midline defect oftentimes. And
but it's
there's even
isn't that kind of like a euphemism?
Yeah.
Right?
Totally.
Isn't that totally a euphemism? And like for me, people who know me, like my personality is like, tell it like it is, call it like it is. That's what it is. Our children are being born with birth defects. And yes, while it may not be a severe birth defect, and oftentimes it's not, because it's an internal like organ, right, or muscle, it's not something that you necessarily always see, but it has huge, huge, outstanding implications for whole body health, not only at birth, but for the rest of the child's life. And so my call to action is, our children are being born with birth defects. Now, it's very common. And on the one hand, we can talk a lot about the downstream treatments, but from my perspective, I'm so much more interested in talking about preventing this from happening. And the only way that we're going to prevent this from happening is also as mothers, especially. Now, this is not where practitioners are going to come into the conversation, but as mothers specifically, we need to understand what the sort of like antagonists, what the troublemakers are that are disrupting embryologically the fetal process. And I think we all know what they are. And, you and I, Hallie, you and I can probably go through a long laundry list from endocrine disruptors, phthalates, fragrances, wearing, what do you call it? Like wearing polyamides and polyesters and having microplastics in our bloodstream, to non-organic food, the pesticides, the herbicides. I mean, we could go on and on and on forever. I mean, it's literally to the point where, like, I know floss, like floss is toxic because there's forever chemicals in floss, and then it gets in your bloodstream. It's like, the Teflon pans, what you cook with, what you wear, what you eat, what you drink, what you buy, the mattress you sleep on. I mean, it's enough to drive you crazy. It is. And I have such compassion for all of my mom friends. And I have girlfriends who they exist in different universes. I have girlfriends who are like Maha. I mean, we are like OG, and we've been in this fight for 15 years, 10, 15 years. And I have friends who don't know what I'm talking about, and they have no interest in what I'm talking about. But, I think my message is for those who have ears to hear, before we use me as a cautionary tale, we should look at ways in which these issues can be prevented first, because that's my lane, and that's what I care so much about. And obviously there's so many wonderful, speakers and role models and, peers that we have in our generation, like millennial moms who are picking up their banner and waving it, and sharing resources about how to reduce all of the offensive, inflammatory, dangerous, toxic things that we come into contact with. Because the truth is, we are under assault. We are being bombarded, and our children are the ones paying the price. And the tongue tie epidemic is, it's caused, right? It's caused by all of these agents. And so I think that's me getting on my soapbox for a minute, but definitely had to be said.
I love it though, because that's, in my pediatric feeding course, the two topics that I teach, the two modules are tetheral tissues and myo, and how to apply that at birth. Because as SLPs and OTs who do feeding, we need to be looking at this when the baby's born, because you touched on a couple of really great things. Everything around the epigenetic conversation that you just, highlighted, but also I always say we're connected from the tip of our tongues to the tip of our toes, right? Through fascia, right? And, so that's something that is just so incredibly accurate, but something that I didn't know 10 years ago. It wasn't until I had children and both my kids were tongue tied and they both had high narrow palates that I fell into all of this and started to go, oh my gosh, how many other patients have I worked with that could have had a very different outcome? But can we go back, or can we start here now with these patients that we're already working with and start to shift our approach, right? But I love that you're taking it back to the root cause, because we are very much so like root cause practitioners. And I talk about root cause on this podcast all the time, and how everything, like you said, is interconnected. We don't exist in a silo, but that's how the traditional medical system operates, right? That's how traditional medicine works. And I think there's a time and a place for everything, Eastern and Western, right? And, just like your own journey, you're kind of figuring out like, what direction am I going to go? Because there's all of these pros and cons to going with, and obviously I won't give you advice on that. That is your journey to kind of figure out right now. But I do think it's so fascinating, because a lot of us are in that same space, right? And in different ways, but similar ways, right now. And our mouth is our window into health. Like, health starts in our mouth. And so when you were talking about that, I was like, yes, everything from where our tongue rests. You mentioned that, the tongue develops between weeks 4 to 5. Well, by week 12 and a half, right? We are swallowing already. The way that we swallow at the end of the first trimester is the way that you're going to swallow when you are born. And so that's not going to change. That's not going to change, right? Between 12 and a half weeks and birth, you've already got your swallow pattern down. And if your tongue is not resting on the roof of your mouth, forming the natural U shape of your palate, guess what happens? It starts to collapse, right? And so that happens in utero. So there's a
Yes.
whole host of like things that snowball in utero that people are not right. I mean, we all know that amazing things happen in utero and that there's just so much growth and change happening, but it comes back to some of the most critical growth, and that is the tongue and the palate, because that impacts our airway, which impacts our sleep, which also impacts our general ability to have a healthy immune system, right? And so everything, like you've said, is so, I mean,
Everything.
we could just keep going down this rabbit hole, but it's so interconnected. And so a lot of people say, oh, it starts at birth. No, it starts at conception. It
Exactly.
starts
It
at the
starts in
beginning.
utero.
Yes.
Yes.
Yes. And I also loved that you highlighted CST and osteopathic manipulation, because my second daughter was a kiddo who um, we had her released, her tongue tie released day 5. And she breastfed. I'm making up new words. Breastfed beautifully compared to my first, who I did not know was tongue tied until she was 24 months old, and we had a very painful 13-month feeding journey. But I was stubborn. And the one time I tried to give my first one formula, she had a total horrible reaction. And I was like, nope, it's not happening. We're going to figure this out. I'm too stubborn to do any other way. So we're going to make it work. My second one was born at that point. I knew about tongue ties, release day 5, beautiful breastfeeding journey. But she dragged one of her legs behind her when she was scooting across the floor and never truly crawled. And what I knew about development at that point was like, okay. And so I like to use her story because it shows that full body connection. So while we addressed the fascia in her mouth when she was born, I didn't really address the body immediately. We did start to address it around like 3, 4, 5, 6 months when she was not doing all of her gross motor. It was like always kind of hanging on, where kind of where she should be, but not quite. And I was like, I just want to get ahead of it. Well, I had her in pediatric PT for maybe 8 months. Okay. It wasn't really doing anything. Just going to put that out there. I go to a craniosacral therapist. She's maybe 12 months old at this point. Like she's still not crawling, maybe 12 and a half months, whatever she was, right? And she teaches me about some Chinese medicine. My daughter always runs hot. She does this manipulation on her back. Stop sweating in the car seat. I was like, what the? Okay, I'm in. You've
Yeah,
got me.
exactly.
Teach me more. Teach me more. And then the next week, I took her to this osteopathic couple. And I kid you not, within days, she pulled herself up, started like cruising, and then was crawling. So then she started walking. And my husband's like, wow, she's walking. And I was like, yeah, she's walking, but she's not crawling yet. All of a sudden, like the next day, she crawls across the couch, which most people are like, who cares? She's crawling. She already walks. No, this is important for development. Like there's crossing of the midline. There's a lot of things that are happening when we crawl. And it's also it's not a stable surface. So the fact that she was able to crawl on an unstable surface after CST and osteopathic manipulation, one treatment each,
That's amazing.
after having 8 months of PT with no results, and months went by between, PT and me taking her to these practitioners. So people can't say like, oh, you don't know which one it was. No, I know
You
what worked
know.
and what didn't work. Okay.
Yeah.
And I was sold at that point. I was like, I can't explain it. I don't know why it worked, but I know it worked. And she's been my upper respiratory kid. But aside from that, from a gross motor standpoint, her body has developed beautifully, and she's never had any other struggles. And so that really kind of was my dive into that world at that point. I was like, I was already in the tongue tie world. I was already in the myo world and the pediatric feeding world, and understanding that there's a root cause behind all of this. But then I saw that and I was like, oh, this really pulls it all together for me. I wish I knew about this when she was born, because I would have taken her straight. Instead of going to the oral surgeon, I would have first gone to the craniosacral therapist or the osteopathic doctor. And then we would have gone for the tongue tie release. And then we would have come back for more body work. And that's just where that's where I'm such a big proponent for anybody who's doing any type of intervention. You have to be supporting the entire body through the intervention with craniosacral, with osteopathic interventions. It's critical.
And I think that sage advice from, right, so mothers who are like, we're war torn, like we've been through this for years and we have lessons to impart to younger moms, is truly start with the least invasive approach first. So if someone is telling you, let's snip, let's cut, let's do a surgical intervention, just take a breath and ask other mothers, like read books, go to the library, search podcasts, like get onto social media, find a crunchy, holistic, alternative mom group, like ask before you jump into surgical interventions, because there is a lot of wisdom that we can share with each other, and addressing the fascia
Yes.
first and foremost before we cut or snip is prudent. It's prudent and it's wise. And right, I think it's just also common sense. Like we want to do that.
And also, to interrupt you for 1 second, also, sometimes there appears to be a fascial restriction that doesn't actually exist because of how fascia, like you said, the fascia remembers, right? So because of positioning, it could appear that there is more tension than there actually is. Something could mimic a tongue tie. You go through craniosacral, you go through osteopathic intervention. Sometimes that's enough to relax the body where a surgical intervention is not necessary. So I'm a big proponent of, if you need it, for sure, let's do it. Let's make sure the body's prepped the right way. Let's make sure we have the right pre-op and post-op approach to addressing this. But also we've seen cases where it's not necessary to actually surgically release the tissue.
Right.
And who knows, maybe down the road it becomes a problem. I'm also not a big proponent of we don't have a glass ball. I don't know if it's going to impact you versus somebody else. We go based on the symptoms right now. Is there impaired function? If function is impaired, let's address that. But let's get down to the root. Let's figure out why we think this is happening and see if we can work from there in the least invasive way. So I love that you brought that up, because I think it's such a critical topic of conversation.
Yeah. And I don't know if there's disparity or if there's some contention in your professional community between what is that root cause, right? So, I mean, as a mom and as someone who is asking questions and talking to different professionals and trying to figure it out myself, personally, for me, all I can say is I've come to the conclusion that the fascia is the root, and that it, like we discussed, it's a embryological and in utero issue, and then compounding that with birth and what happens to the fascia and the child, everything at birth and then beyond, is for me starting at the beginning. So that's why I brought up Dr. Barry Gillespie, and that's why I'm so excited to hear, because I haven't listened to all the episodes. I did try to go into some of your history, but I didn't know you had Gillespie, practitioners on, and that's fantastic. So I'm just so glad that that's being talked about more, because in terms of your world as a professional in this genre, you know about it, but in the general population of mothers, I mean, even Dr. Gillespie's work is not that mainstream. So I think the benefit to babies and children is going to be huge if that piece of the perspective can get woven into more mainstream care as time. And, unfortunately, it's going, you and I both know, it will take a long time, right? It takes decades. It takes decades for what we find sort of cutting edge holistically to be woven into the mainstream narrative, or to be even accepted, because most of the time it's vilified and it's crucified as quackery and not peer reviewed. So,
conspiracy theories, and I love the whole, what's the difference between a conspiracy theory and the truth? 4 years. I don't know. I mean, just give it some time and it'll all come. Yeah. It's like everyone who thought I was a conspiracy theorist in my family 4 years ago, they're all going, oh, wow, there was some merit to what you were saying. Oh, okay. Yeah. You believe me now that your news sources are confirming that what I said 4 years ago is true. Got it. Okay. We're all on the same page now. Great.
And then you know what? It's similar to the physician, the osteopathic doctor, the DO. So instead of seeing an MD, for general family medicine, I have a DO. Instead of an MD, he's a DO. And again, I don't know if a lot of just general American mothers know the difference between medical doctor and doctor of osteopathy. And you know what? Cheers to my sister. So my sister, I have 5 sisters, but one of my sisters is actually an MD. She's a cardiologist, and she actually went through the DO. She went through a DO program instead of an MD program. And she actually turned me on to some of the interesting facets and components of osteopathy. And she's the one that gave me the recommendation for the physician that we see, in my hometown. And, you know, he can prevent and treat ear infections without antibiotics.
Isn't that amazing?
So isn't that amazing?
Isn't that amazing?
It's like such a fascinating conversation to have with someone who either doesn't believe or is ignorant and doesn't know anything about alternate paths.
Yeah.
So,
well, the
pandemic,
pandemic,
that applies to so many things in life, not just health, but as you and I both know, like everything.
yeah. Well, during the pandemic, after I was telling you before we recorded, my 3-year-old around that time basically had croup 9 times in a year. She wasn't 3 yet. She was 2 during the pandemic, but she had a history of RSV, croup, upper respiratory infections. You would sneeze in her vicinity and she would get a cold and then it would turn into croup like within 24 hours. And then she'd be on another steroid and more puffs of this. And we went to, a pediatric, what are they called? The pulmonologist, the specialist and everything. And he was wonderful. But at the same time, it's like they put her on an inhaler at 2 for the summer. And then that seemed to help things go away. And that was the same point where I was starting to feel uneasy about everything. Because I was like, history's repeating. She's been on the same meds. Yes, maybe they help short term, but nothing seems to be getting down to the root cause of this issue. I don't understand why nobody can help us. And, then I was being told, oh, she may be a kiddo who has pediatric, why am I'm like, words are hard today, man. I am tired. Asthma.
Okay.
And I was like, I don't know. I don't agree with this. I feel like this is completely preventable. And if like, you're not going to help me figure out how to prevent that, because she's only 2, I'm out. And so, right, pandemic happens. I'm at home. I'm just Googling different ways, like different alternative approaches to treating children with croup, and like at this point, I'm used to this kid having this like scary barky cough in the middle of the night. I know what croup is. Like, I know if I open my freezer door and she stands in front of it, it's going to help calm down the airway. Like, we've got all of our little solutions, right? And I stumble upon homeopathy. And I'm like, this is interesting. And then I stumble upon some speech pathologists who use homeopathy in my space. And I was like, oh, okay, these are my new besties. Like, I need to have conversations with these people. And so they tell me like where to start taking courses. I start taking my own courses really for my family's use, right? For my own knowledge.
Yes.
And that was like, the rest is history. I basically, between homeopathic interventions that I learned, and I did expand my kids. So she was expanded at age 4. My other one was also expanded at age 4. Between their expansion and opening their airway, once her airway was open, because we have CBCTs on both of the kids, and I haven't done an after on her because she probably needs a little bit more expansion. And I'm, I don't need unnecessary radiation to prove anything to anybody. But on my older child who had early expansion, she went from having very full, and she started with an ALF appliance too. We didn't go directly into like the rapid expander. We started with the ALF, which seemed very, she was kind of a sensory kiddo and nervous system was, a little all over the place. And that thing went in her mouth and she was like the chillest thing. Like, it just calmed her down. And I was like, oh, okay. She could still eat. Her palate was open. So you're less like locked up because it's just around expanded around 2 teeth, And so I was like, okay, I'm digging this. The only reason we didn't, well, let me back up. So I have her CBCTs that are about 2 years apart, but she had that in her mouth. She only needed it for about 9 months, had it for a year because pandemic. And we didn't do any body work during that time because everything was shut down in Maryland. I would have liked to, but we didn't. And she still, within 3 months, went from having almost touching tonsils that were super inflamed to having normal sized tonsils. Her tissues just calmed down.
Amazing.
It was amazing. Her before and after CBCTs, you can see that her sinuses were filled. They are no longer. Her, airway, like where her turbinates are, it just looked so inflamed. It was so full. Like, how was this kid breathing? Her adenoids were enlarged.
Yeah.
Everything was normal. At age 5, when she had her follow-up CBCT, we moved down here. I presented with some colleagues. They were like, she still needs some more expansion. So I ended up putting her into a short-term Hyrax with that had a forward growth component with a biological dentist down here in North Miami. But my younger one ended up going straight into that same appliance, the Hyrax, because the research does show for a child who has like a airway issue that's more emergent, like high croup, 9 times in a year,
Yeah.
that you want to expand faster for the sake of the airway and brain development and all of that. And so I was like, okay, it's a short-term thing. Like, let's do
Yeah.
it. And I will tell you, her croup stopped when we expanded her. And I was like, I'm sold. I mean, this is what I literally do in my practice. I pro all of these things, but I now have their cases, my own children, as evidence of how beautifully this works when we use the interventions that we feel called to use as moms, right? I'm not a dentist. I'm not an ortho. I don't know anything about moving hard tissue and bone, but I
Right.
knew enough to know my kids, I feel like this is what my kid needs right now. We're going to run with it. And it was a beautiful thing at that time. They've also been in, you mentioned the tooth pillow. They've had myobrace, which was more so to guide their continued growth
Yeah.
after expansion. The one thing I don't love about it, and I'm very vocal about this, is so first of all, my older one cannot keep it in her mouth for more than an hour. She gags on it and spits it out every night. So it doesn't really serve much of a purpose, right? But my younger one who chomps away at it, and we had some like buildup put on their back teeth to help so that if there is any grinding, they're grinding that down and not their teeth, and to help kind of develop the jaws a bit better. The planus tracts, they call them. But my younger one who wears it actively and all night long, right?
Good.
I looked at it one morning and there was mold inside of it. And we clean this thing daily. And I was like beside myself because I was like, there's mold in this appliance. We clean this every day. There was mold in it. I completely freaked out because I'm like, oh my God, mold illness. Like, like that's the last thing I want is this appliance is supposed to be helping my kid has like molds in it now. And she had a little part of it that did poke
It
through
should break down
because, if you're using, and they tell you on their website, if you're using the appliance appropriately, this is going to happen. It's going to break down. But no one had ever told me that. And so I was a little bit surprised.
Exactly.
I texted our dentist and I was like, hey, and they're like, no worries, we'll get you another one. And I was like,
maybe every like
okay,
6 months,
but
depending
also
on the wear and tear. But
yes.
I get it. Like one of the risks inherent with those, stationary silicone mouthpieces, guides, is that they are, especially when you wear it overnight, they definitely do breed bacteria, which can lead right to some cavities or, some, I don't know, maybe just like inflammation and things like that. So yes, that's just, I think, one extra step in terms of just being so diligent and like with the cleaning and the disinfecting. So yes, like as moms, it's just one more thing we have to do, but I get it. Yeah.
Yeah.
I think it's so similar.
And so, and I'm not as
I
familiar with the
it's
tooth
so
pillow. I
similar to
follow somebody who's been
myobrace,
promoting it on social media.
the
But
Vivos appliance.
well, yes, I pulled up an actual, I
Yeah.
pulled up an article about that like
Yeah.
randomly the other day, and it said tooth pillow basically uses the myobrace system, and it may have been the Vivos or something. And I was like, okay, well that, because there's also like
similar.
Healthy Start and it's all these different like programs that kind of mirror each other. So I'm curious. Yeah, so I'm curious to know, because your kids are older, and I know my listeners are going to be like wanting to know, how are they using it? Like, what is the goal with using that for older children? Because I always thought it was more geared towards younger children.
This past year at 12, she is the one who got put into the tooth pillow at the very tail end of that jaw development. So she currently, her transverse measurement, it's really, I think it's like between 35 and 36. So it's still pretty small. And the goal was, no, she had already been in braces right. I had fired that other orthodontist she had presented herself as an airway focused dentist / orthodontist. And she was actually referred to me by a myofunctional oral therapist that was very esteemed and like long standing in my local community that I trusted. And she had sent me there, and we really did not see eye to eye, and it was not a workable professional relationship. So I took the braces off. I now am in a different state seeing this new practitioner, one of the co-founders of Tooth Pillow, and he said, well, actually, we do still have some expansion and some growth I want to see happen. I'd like to see her get to 40. Let's get another 5 millimeters. And so far, because of the braces, I mean, her alignment looks actually pretty good. I'd like to do a year of tooth pillow. I'd like to do a year of the guide appliance, and I'd like to see how much we can get done in a year. So he was like kind of taking, at least with my one child, because the other two are very different. It seemed to me kind of like a very gentle, slow approach. She was developmentally, like biologically, like chronologically, I mean, a little bit behind. Like her 12-year-old molars, like she was 12 turning 13, but her 12-year-old molars, I think, had like just erupted. So I don't know if that was, she might have been like chronologically a little bit behind, and he felt like we have time. And let's just take a very slow, gentle approach with this. I think we're going to get nice progress. And then of course, like a year from now, we'll reassess. And the conversation that I had with him was, it really changed over this past 6 weeks, right? Because we've been there now for, I don't know, like 6 months. But the conversation recently really changed once I realized the implications for myself and the size of my palate and the wisdom teeth removal and the impacts. And me, I'm literally at the point where all I want to do is ensure that my children's jaw development is as large and as wide as I think genetically possible for them, so that if and when they do get their wisdom teeth, now I don't know if they have all four, because some people only get two, some people get four. We haven't done x-rays yet.
Right.
If and when they do get their set of wisdom teeth, all I care about is making sure that they have a jaw that can fit them, so that they never have to go through the trauma that I went through and then have the long-term implications on the back end of what I'm living with now. Because it's a double assault, right? And I said to him, okay, like I appreciate kind of we're taking this like very prudent, kind of like gentle approach. But I just want to be clear with you that, if it's too slow going for me, and she's 13 turning 14, and now we're getting a little bit up into the teenage years, like I just want to be sure that we can reassess and do expansion and get her to 40 or more, or 41 or 42, whatever the case may be. So in that respect, I would say the relationship, the professional relationship we have, like mother practitioner, is so much healthier and so much better because we have such a nice dialogue. And I think, again, this is for your listeners, and as a mom, the doctor patient relationship, especially as mothers, I think so many of us struggle with being able to challenge or ask questions or feel like we are actually being heard, and that our concerns as mothers and our maternal intuition and the things that really matter to us are being validated. And it isn't just lip service. I think it's like a deeply, it's like a psychological, emotional issue that women have, that mothers have. Whether the practitioner is male or female, it doesn't matter. That dynamic, I know it's challenging. And that pertains to all manner of medical interactions, whether it's the pediatrician and you're being pressured to do, I don't know, procedures that maybe you don't want to do, or that you feel skeptical or uneasy about with, well visits, things like that. It doesn't matter. Or whether you have a practitioner advocating for a surgical intervention. My heart really goes out to mothers who struggle with that. And what I'll say is that it took me a long time. And it's really only with age and finding my voice, and learning how to advocate and ask questions and challenge when necessary, that your children will ever get the care that they deserve. Because if you are not willing or able and they're two totally different things, right? They're totally different things. But whatever camp you find yourself in, if you still struggle with that, mother to mother, I would say that has to be, that must be the thing that you focus on first and foremost for the health and well-being of your children and your family, and the legacy that you're going to leave them for their long-term health.
Yeah. No, I love that. I've had all kinds of experience with the practitioners as someone who owns a private practice in the DC metro area and now lives in South Florida. I'm no longer practicing myself, but I was turned away by an ENT with my daughter's tongue tied because I was no longer breastfeeding. I was turned away by another one because, her mouth is closed and she's nasal breathing. I'm like, for the 2 minutes you've been in the room with us. Finally took her to an oral surgeon who was like, this is like one of the worst cases I've seen. There's definitely a functional impact. Like, let's figure out the plan, right? Then with my younger one, I no, actually it was the same one, my older one. When we moved down here, there's an ortho in Boca Raton that everybody goes to and everybody loves, and he claims to be airway centric, and his evaluation was very airway centric. I will give him that. When we sat down, and mind you, Lily had already had an ALF appliance and had some expansion, but she needed more expansion. And I had colleagues who saw me present her case at a dental conference and tell me, the two of them afterwards, hey, I think she needs more expansion. Like, it wasn't coming from me. It was coming from other dental providers who move teeth for a living, right? So, and I didn't say anything to this guy at that time. I wasn't gonna be like, well, my colleagues and friends said, yada, yada. No, I gave him full opportunity to basically lay it all out there. He did a beautiful presentation. He recorded everything. He has a CBCT in office. Pull it up on the screen, to have a real-time conversation and talk through everything and her angles and this and her airway. And we get to the end and he literally looks at me and he goes, why would you want to mess up her beautiful face? You're going to fatigue her. She doesn't need any other expansion at this time. And I almost jumped across the desk and strangled this guy. I was like, first of all, what is wrong with you? You would say something like that in front of my child. Like, let's just start there. I was like, second of all, no, I don't agree with you. Yeah. I know I'm not a dental provider, but I've been told by others that, anyways, I was very calm, cool, collected, and he knows what I do for a living. And so I was there with him for 15 minutes going back and forth to the point where his front desk was coming and trying to be like, you have other patients you need to go see, this consult needs to end. And I said to him, you know what? It's no problem. Thank you. I'll pay $100 for the scan results that you're going to send off to Beam readers because I want those and I don't want to have to do another CBCT anytime soon for her. I was like, but we're done here. Thank you for your time. And I left. He called me an hour later when he was done seeing patients because he knew I was pissed. And he was like, he was trying to smooth things over. And now he's all being smooth talking. And, I see what you're saying, but I don't think, and I was like, with all due respect, this is not going to work for the exact reasons that you said. You could be the greatest provider, but when you go so far as say something about the appearance of my child in front of them in such a derogatory way, that's number one. Yeah, we're done. I was like, and then you go on to basically tell, I was like, this was not airway centric. I was like, your eval was, the rest of it was not. I deal with medical professionals all the time in this space. Thank you for your time. We can agree to, and I said, we can agree to disagree, but I hope that you'll be open. Because he literally sat there and told me that every other professional in this space that my colleagues have learned from were a total crock of shit. And I was like, oh, okay. All right. That's good. It's like someone coming to you and saying to you, oh, Gillespie, no, that doesn't work. That doesn't work. And you're like, I have evidence that it does. I've done it. I've healed. But sure, you have your story. I have mine. That's fine. Yeah. It was wild to me. So then I started driving an hour and a half to take my kids further south to go to somebody who did get it and who was on the same page and who was like, you're absolutely correct. And this is the time to intervene. Let's go. And I was like, okay, amazing. So anyways, long story short, also moving down here, when I jumped into the holistic space, which was really more 10 years ago, but I've gone deeper and deeper and deeper since, it's like my friends come into my house and to pick up their kids and they go to my pantry and they take pictures of the foods that I have because they want to know what to feed their kids for snacks. I'm like, I feel like I'm so, working with functional medicine, and they're like, well, you literally do everything on the checklist here that I
Yeah.
give to patients and have to educate them on. So like, this will be a very easy journey for us. And I'm like, I've been doing this for 10 years. Like, this is not new to me. I'm just trying to figure out what's next on the journey to help us continue like thriving and healing, and whatever else comes up. Like, how are we going to, adapt? How are we going to
Right.
address it? Because for us, it's a little hard to go back and deal with the root cause, that happened in utero. So unfortunately, on the back end, we are dealing it in the best way we can. But I have these conversations with moms who are about, who are like, okay, I know that there's like epigenetics involved with tongue ties, right? And so how do I prevent my next child from having a
Basically,
tongue tie?
like,
I'm like,
become
well,
Amish.
here's a laundry list of things
I mean,
that you can start looking
the
into.
truth is, like, and
I
that's
think
kind of like, it's facetious of me to say, and I hope it
right,
doesn't come
right,
across
exactly,
as, like insulting or
exactly.
anything. But the truth is,
Yeah.
we're up against a lot. We're up against a lot, and the effort and the commitment and the discipline that it takes, and also like the
Yes.
It's more than that. It's like a deep devotion to wanting to protect like what is sacred, and that essentially is creation, right? It's like God blesses us with these perfect children, and God's design is perfect. There are no mistakes. Creation is perfect. We see that in symmetry. We see that in mathematics. We know that we are a reflection of the perfection of the universe. Like the roots of a tree, the conical like swirl of a seashell. It's that's within us in the same way. And the departure, like the further that we depart from like nature and I think God's perfection and symmetry and perfect geometry, the harder and harder life becomes. And as modern women, we find ourselves living in this post-industrial world, right? 100 years ago, this probably really wouldn't be a conversation. Okay, our great grandmothers did not have to deal with this. There was no forever chemicals. There was no Teflon. There was no chemical warfare with fragrances coming into our home and our personal care products and phthalates and endocrine disruptors. There wasn't really even industrial agriculture. There wasn't pesticides, herbicides, and insecticides. There wasn't glyphosate. There wasn't Roundup. So this is a very modern post-industrial world that makes our life as modern mothers challenging. So it's more than just it's more than just like, let me put the list on my fridge and try to like avoid these things. It's a truly deep devotion to wanting to preserve the perfection of what God has created. And I think that there can be, and I can attest to this because I find myself going through this. It's like a fatigue. It's like an emotional and spiritual fatigue that you feel as if, what am I going to do? Right? What could I possibly do? Every week, every month, there's something else that we learn. There's somebody else. There's some new podcast. There's some new book.
It feels
there's
like
some new revelation. So I say all of this, like, not to be, and I hope that like the message and the conversation that we're having today is inspiring and not despairing, because that's not what it is. That's not my message. I think that being aware, being educated, and being devoted to preserving the beauty and health of your children is the highest and utmost calling that we can have as mothers. So that is kind of just like my blanket position. There's nothing more that you could do, nothing more beautiful that you could do for your children or give to your children than that. But at the same time, in the same breath, as a woman, as a mother, living through this generation and raising children, I'm in it with you. I'm walking this road, and I'm here to say, I know it's hard. I cry. I get frustrated, I get fatigued, but don't ever give up. And it's like my page, like my handle, it's mother of metal, right? And what is metal? Like the dictionary definition of metal is having courage, and optimism in the face of like hard times or challenges or despair. So like when you have metal, it's like, oh, you really test your metal. That's why my community is mother of metal. I get it. I really get it. I walk this path, and my heart goes out to all of us who are navigating this. And I think it's doubly challenging when we ourselves, right, as the mothers who are tasked with protecting and preserving the health and beauty of our children, when we ourselves are also struggling, because we are also already the unfortunate benefactors of a previous generation's mistakes. And so, I'm that person, I'm that mom. And I get it. And it's like, I'm just giving a big virtual hug to all of us out there who are kind of doubly impacted by a lot of these issues. But, the smile on our kids' faces, the ability for the croup to disappear, the ability for them to sleep through the night, the ability for the ADHD and the behavior symptoms to go away. It's all worth it, right? And we know that, and that's why we do it.
Yeah. Yeah. Well, Brianne, thank you so much for sharing your
adventure.
story, your kids' stories, your journey. You didn't call it a journey. You called it what did you a big adventure. Yes, yes. I mean, and it is, because I mean, I feel like a journey should have a start and an end. there's a start, but I'm not sure if there's ever going to be an end. But yeah, I mean, you speak so eloquently and so beautifully about these topics, and I think this is going to be so encouraging to a lot of moms, and especially even moms who are also practitioners, because sometimes we are really hard on ourselves. I speak to a lot of friends in the space that are like, I feel like I should know this. I feel like I should be doing better for my kid because I have the information and I have colleagues and I have the access. But, at the end of the day, we're all mothers trying to navigate the best way forward for ourselves, for our children, for our families. And so I think you really, that big virtual hug is
Thank
definitely something I think a lot of people need right now.
I loved talking
And,
to you,
just
and
major thank you. Thank you, thank you, thank you.
New things from you. And I hope that your listeners learned some new things, or just had some new perspectives from the things that I had to say. And God bless you.
Amazing. Amazing. Thanks for listening to this podcast. If you found value in this episode and want to hear more of these Myotots airway and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at HallieBalkin.com, or pop over to @HallieBalkin on Instagram to get all the latest updates.